Azithromycin is an antibiotic. It's widely used to treat chest infections such as pneumonia, infections of the nose and throat such as sinus infections, sinusitis, skin infections, Lyme disease, and some sexually transmitted infections. Azithromycin is used in children, often to treat ear infections or chest infection. It can also be used long term to prevent chest infections in people who keep getting them. The medicine is available on prescription as capsules, tablets, and the liquids that you drink. It can also be given by injection, but this is usually only done in hospital. Key facts: azithromycin is usually taken once a day. Try to take it at the same time each day. If your doctor has prescribed azithromycin capsules, you should take them at least 1 hour before food or 4 hours after eating. If you have tablets or liquid, you can take them with or without food. For most infections, you should feel better within a few days, but you should still finish your full course of medicine. The most common side effects of azithromycin are feeling or being sick, diarrhea, headaches, or changes to your sense of taste. Azithromycin is also called by the brand name Zithromax. Who can and can take azithromycin? Azithromycin can be taken by adults and children. It isn't suitable for some people. To make sure azithromycin is safe for you, tell your doctor if you have had an allergic reaction to azithromycin or any other medicine in the past, liver or kidney problems, heart problems, including irregular heartbeats, arrhythmia, had diarrhea when you have taken antibiotic before, myasthenia gravis. Azithromycin can worsen the symptoms of this muscle weakening illness. Diabetes. Azithromycin liquid contains sugar. How and when to take it? Azithromycin is usually taken once a day, unless you are having it by injection. Try to take your medicine at the same time each day. The usual dose is 500 mg a day for 3 to 10 days, depending on the infections being treated. For some infections, you will be given one of higher dose of 1 or 2 gram. The dose may be lower for children or if you have liver or kidney problems. Azithromycin is sometimes prescribed long term to prevent chest infections if you keep getting them. In this case, it's usually taken 3 times a week, often on a Monday, Wednesday, and Friday. Important: carry on taking this medicine until the course is completed, even if you feel better. If you stop your treatment early, your infection could come back. How to take it? If your doctor has prescribed azithromycin capsules, you should take them at least 1 hour before food or 4 hours after eating. If you have tablets or liquid, you can take them with or without food. Swallow tablets and capsules well with a glass of water. Azithromycin liquid is available for children and people who find it difficult to swallow tablets. If you or your child are taking azithromycin as a liquid, it will usually be made up for you by your pharmacist. The medicine will come with a syringe or spoon to help you measure the right amount. If you don't have one, ask your pharmacist for one. Do not use a kitchen teaspoon as it will not give the right amount. The liquid can have a bitter aftertaste, so it can be a good idea to offer children a drink of fruit juice afterwards. If you forget to take a dose, take it as soon as you remember, unless it's nearly time for your next one. In this case, just leave out the missed dose and take your next dose as normal. Never take 2 doses at the same time. Never take an extra dose to make up for a forgotten one. If you often forget doses, it may help to set an alarm to remind you. You could also ask your pharmacist for other ways to remind your medicine. Side effects. Like all medicines, azithromycin can cause side effects, although not everyone gets them. Common side effects. These common side effects of azithromycin happen in more than 1 in 100 people. Keep taking the medicine, but talk to your doctor or pharmacist if these side effects bother you or don't go away. Feeling sick, diarrhea or being sick, losing your appetite, headaches, feeling dizzy or tired, changes to your sense of taste. Serious side effects are rare and happen in less than 1 in 1000 people. Call a doctor straight away if you get yellow skin, or the whites of your eyes turn yellow, or pale poo with dark pee. This can be signs of liver or gallbladder problems, ringing in your ears, temporary hearing loss, or you feel unsteady on your feet, vertigo, severe pain in your stomach or back. This can be warning signs of inflammation of the pancreas. Diarrhea, perhaps with muscle cramps, that contains blood or mucus. If you have severe diarrhea without blood or mucus for more than 4 days, you should also speak to a doctor. Pregnancy and breastfeeding. Azithromycin isn't normally recommended during pregnancy or while breastfeeding, but your doctor may prescribe it if the benefits of taking azithromycin are greater than the risks.